Thank you so much, all the colleagues. Hi, everyone on the call. My name is Justin, and I am the co-executive director here at Chevs. We are a youth-led LGBTQ organization advancing access to healthcare, sexual reproductive health and rights, economic justice, digital rights and safety, as well as inclusive feminist futures for LGBTQI persons across West Africa. Our work is very bilingual because we work across the Francophone and the Anglophone West African region with LGBTQI grassroots organizations and activists. Right. So, Michael, I'm just Anita. Hi, please say hi and introduce yourself before I go ahead.
Hi, yes, sure. Hi, everyone. My name is Anita Graham. I am the interim co-executive director at Chevs, and Justin and I will interchange over the course of this presentation. Over to you, Justin.
Hi, thank you, Anita. So we work a lot around inclusive education and inclusive access to sexual reproductive health and rights, especially as it relates to young LGBTQI persons. And over the course of our work, we have learned a lot of things that in the areas of sexual reproductive health and comprehensive sexuality education. And this is just a baseline that we have put together of a bigger research that we are conducting currently, but this is just a baseline abstract research that we just did within the community, and we were looking to share that with you, and also how that can inform or impact your work or your future work. So yes, next. So it's exploring the case for comprehensive sexuality education for LGBTQI youths. So here's some backgrounds for you. A global LGBTQI group. So because in Nigeria, we do not, you might see key populations and LGBTQI interchangeably. We didn't have time to run through that because in Nigeria and other West African country where the PEPFAR, the Global Fund, USAID make grants, it's not legal to say LGBTQI. So LGBTQI persons are lumped under a group called key populations. So because this is a public document, that's why you're seeing the censoring of key population, which is a public health term for those who are more impacted by HIV/AIDS and other sexually transmitted diseases, which would include men who have sex with men, sex workers, and injective drug users. So just putting that out there. So in case you see that interchangeably, it means the same thing. So key populations experience significant difficulties across healthcare services, resulting in unfavorable disparities and health outcomes generally, and also poor attitude to health-seeking behavior. There's systemic exclusion and social exclusion, which from access to healthcare. In some countries in West Africa, we have explicit criminalization and issues around social criminalization or social stigma. And in 2021, the National Council on Education in Nigeria and other, yes, in Nigeria specifically, approved the comprehensive sexuality education curriculum for Nigeria. But currently, as we speak, that is being repealed, and that has been rolled back or stopped by the current Minister for Education. So currently, Nigeria do not have comprehensive sexuality education in its formal education curriculum. Next, please. Hello. Okay, yeah, the curriculum includes topics such as contraceptions, sexual abuse, gender roles, and all of that. Young LGBTQI persons in West Africa experience significant challenges accessing comprehensive sexuality education. This is often rooted in cultural, religious, and restrictive legal factors pushed by anti-CSE and anti-LGBTQI actors to limit access to evidence-based SRHR under the guise of protection of family values and African values and all of that. So we do not have unrestricted and open access to comprehensive sexuality education, and also even access to healthcare itself. Next. So I'm just like running through the background. This is a very short presentation. So some of the objective of this research is to conduct a baseline in Nigeria and in some other countries aimed at investigating the LGBTQI youth seeking CSE information, particularly about their sexual and reproductive health rights. This study also highlights the implications of an absence of comprehensive sexuality education in traditional learning environments and the associated risk posed by social media as a poorly regulated source of health information. The study adopted a mixed method approach. Quantitative data was collected using structured surveys administered to 110 respondents between the ages of 15 to 35, and qualitative data was collected through 3 focus group discussion: Nigeria, Ghana, and other Nigeria, Ghana, and what is it called? Senegal. Yeah. So next page, I'm just going to bring in Anita to do this.
Yes, thank you. Can you confirm that you can hear me?
Yes, I can hear you.
Yes, we can.
Perfect, thank you. So, based on the research that we conducted, one of the findings was that LGBTQI plus youth experience discrimination when accessing sexual and reproductive health rights information and services, with about 71% of respondents experiencing some form of discrimination, verbal abuse, refusal of care, stigmatization, physical violence, and a lack of attention from healthcare professionals in mainstream healthcare centers. And this is a phenomenon that is replicated across the different regions, the different states and countries within in Nigeria. We see that a lot of times LGBTQI plus youths do not want to access sexual and reproductive health information and services from traditional systems because of notions, perceptions, and fears that they would be discriminated against if they appear in their true identities, that they would not access the level of information that they require or the kind of services that they require, or that they will be outrightly turned away or experience some sort of violence. I know quite people who have been to healthcare facilities to request for information around contraceptives, for instance, and they ask questions like, why, if you're a lesbian couple, why do you need contraceptives? Things like that. And you begin to wonder what kind of space that we are creating for queer persons to exist truly and to access optimal, sexual and reproductive health and rights information and services. We also saw that 62% of those who participated in the survey felt that they received negative treatment as a result of their queer identities. And most of the times, queer persons resort to having to hide their identities when trying to access sexual and reproductive health and sexual and reproductive health information and services, because they feel like their identities will be placed before their health needs or before their health priorities. And these negative perceptions usually skew the kind of services that they are able to receive from healthcare providers within like the mainstream systems, as well as even within the newer health systems that are emerging within the Nigerian context. Next slide, please. We also found that 1 in 3 LGBTQI youth are unaware of their sexual and reproductive health and rights needs, as well as where to access appropriate information and services. So and this is also reflective of the realities of queer persons within the West African region, where they are not even aware of what kind of information is available, where they can access this information, who they can access this information from, as well as if it would even be relevant to their needs and their priorities and experiences. Next slide, please. Yes. So one of the things that we also focused on in this research was to try and figure out where queer persons were accessing their sexual and reproductive health information or services from. And we found that a majority of LGBTQI youth are accessing their information from the internet and websites, particularly from social media. So there's a lot of with the rise in the use of social media platforms within our generation, we're seeing that there's a lot more medical and health information, misinformation, and disinformation happening across various social media platforms. So you would see people who tout themselves to be certified nurses, doctors, and health practitioners providing information about sexual and reproductive health and rights and sexuality education across Facebook, Twitter, Instagram, TikTok, amongst others. And because we do not have formal systems to provide comprehensive sexuality education or even reliable and verified platforms within our Nigerian context or the West African context, to access sexual and reproductive health and rights information or to access comprehensive sexuality education, young LGBTQI plus persons are turning to whatever information that they can find across these platforms or these services. We see that there's also a very limited number of them who are accessing information through non-governmental organizations, for instance, despite the fact that mainstream mainstream organizations in Nigeria are one of the largest proponents and implementers of CSC curriculums in Nigeria. However, the major gap that we recognize is that most of these curriculums and programs that are implemented by mainstream organizations in Nigeria are not tailored to the needs and the realities of queer persons. So because they don't see the essence or the need to they don't see the what's the word they don't see the benefit of accessing this kind of information from non-profit and non-governmental organizations in Nigeria, chances are it's very low chances that LGBTQI plus persons are turning to NGOs to access this level of information. Next slide, please.
Yeah, just also to add, why we're very weary of this development is that looking at the times we're in, there is the rising of fundamentalist anti-right, anti-LGBTQI movements across West Africa. We're seeing the proliferation of family value conferences across Nigeria, Ghana, Cote d'Ivoire, and most recently Sierra Leone, which is going to happen very soon. We're also seeing how they have like activated personal social media accounts that are like marketing propagandas around abortion, around sex, fear mongering around sex, and preaching total abstinence. And also in most of these countries like Ghana, Nigeria, and Liberia, we see that programs that are close to comprehensive sexuality education, especially around HIV/AIDS programming and SRHR programming, are also being led and funded by being funded by USAID, Global Fund, and the rest, two religious organizations like the Catholic Caritas Foundation, who preaches abstinence to young people and do not even engage in condom distribution or condom messaging and awareness. So this is also like a very troubling development, because now we've had complaints about how people have clicked, let's say, content that has messaging on where to access free, safe abortion, and then it led them to like a church group where they are being a WhatsApp group that is being owned by a church, where they are being preached to not to engage in abortion. So we also seen that there is high, like Anita mentioned, there is high level of disinformation and misinformation that is intended at raising fear and misleading people. And we're also wondering how this engage in the times of government crackdown around abortion, how this would also affect abortion providers and persons who seek abortion, or persons who are queer, who are seeking affirming healthcare, and then maybe land in one of these groups that are being regulated by these groups. So just wanted to mention that as well.
Okay, yeah, sure. Thank you. So just to add to what Justin has said, we've seen that when young queer persons are unable to access essential sexual and reproductive health and rights information and services, as well as really comprehensive sexuality education, they are more at risk and they are more vulnerable to being exposed to sexually transmitted infections and other health issues. We see that it is very challenging outside of the health impact. We see that it is very challenging for queer persons to navigate healthy relationships because they are not learning the essential skills, they're not learning the essential values, they're not learning the essential ideals that they need to form, maintain, and sustain healthy relationships, which is one of the core components of, comprehensive sexuality education. We see that there's still also one of the things that we have also seen as a result of um, not having inclusive comprehensive sexuality education in Nigeria and West Africa at large is the level of um, misinformation and disinformation that people associate with being queer within our context. Because we see that if we have inclusive comprehensive CSC, they cover issues around, gender identity, accepting people for who they are, inclusion and all of those things. But we don't have those kind of things taught in schools. So young people are not able to really understand how to navigate such relationships or such connections, or even understanding, what it means to be queer within our West African context. And we also see that because social media is not a credible source of health information to a large extent, you know, there is so much of a need to um, there's so much of a need to design and implement programs and initiatives and approaches that leverage social media and other digital platforms to provide sensitive and inclusive CSC education that is targeted for young queer persons within our context. Next page. Over to you, Justin.
Thank you. So reliance on social media exposes LGBTQI people to information and potentially crack down and arrest if they are seeking healthcare that is criminalized, like abortion and maybe, let's say, gender affirming care for transgender persons. And maybe they land in one of these groups that I have cited example of. You see that they get arrested and all of that. So we are very careful why this is showing the power of social media and how active or how transformative the social media and digital space can be. But we're also wary of that because then the anti-right groups have also learned how to use social media spaces, which has been a safe space for organizing and mobilizing for LGBTQI group for a while. So we're also seeing how this can be both like a great news to say, oh my God, yes, so if we put out content on social media, people are gonna read, like they're gonna learn. But again, oh my God, what if we put this out and this becomes a thing and these people learn these tactics as well? So that means is that because we a workshop, a curriculum called the VCAT. We have VCAT for abortion, VCAT for religious leaders. So it's an allyship building curriculum or workshop that we administer to different groups of people around different issues. So we've also learned that nationwide value clarification and attitude transformation initiative should be implemented for healthcare professionals to foster inclusivity and responsiveness to the needs of LGBTQI youth. So we've been engaging in VCAT training for healthcare providers across 2 countries since the past 3 years, and we've having trained over 120 something healthcare providers across different facilities in different states, regions, and different countries. We've been able to learn that though these people as healthcare providers might have the necessary expertise to provide everyday medical attention, but they do not have the sensitivity to provide medical care for LGBTQI persons who are looking for this care. And even though we've thought that this at first this was like a very troubling trend. The first time we tried to have these trainings, it was like difficult, but then we went back, we learned how to enter and approach this conversation in very restrictive spaces, and now we're having more conversation, and we're having people invite us to things. Oh, please come train our staff team, or come train our doctors and all of that. So we've been having conversation around intersex traits with doctors, intersex, transgender persons, and also queer women as well. And this has been like very productive for us. And we went ahead, because of the access, we went ahead to launch a directory of LGBTQI friendly facilities across, for now, the tool is for Nigeria specifically, where we collaborated with Google to put these directories together with a Google map. Because what we've noticed that because of criminalization, exclusion, and violence, queer people are highly mobile across West Africa. You see a queer person who lives here today, the next year or the next month, they've moved because they've been outed in that environment, or something has probably happened in that environment. So they need to move to another location. And if these people were in this form of support group or accessing healthcare in a nearby facility, this means that there will be discontinuation in care when they move, because they have to establish connections and friendship before they're able to learn about the safe facilities within this environment. So what we've done is to put together a directory of facilities with Google tag to say, if you're in a new town, you don't need to ask friends. You don't have to have friends before you access care. So just go to this directory and filter, see your address, and see the closest facility to you, and then you go there. So these are like some of the initiatives, the VCAT and the directory are some of the initiatives that we're using to bridge the exclusion of queer people in healthcare. For now, the conversation around sexuality is not very much open within the country. Even within the educational program, we do the gender transformative education program that we implement. We also approach the conversation around sexuality with lots of delicateness, and try to approach everything on that sexual reproductive health and right. But again, we're still experiencing some level of backlash. But this is what we are learning, that the value transformation, value clarification and attitude transformation series and workshop support service providers and societal leaders to become more accepting and more open to this conversation. Like we had a value clarification and attitude transformation workshop with religious leaders on abortion. And it was like really a lot of conversation that went really right, and we can see lots of these affirmations and even subtle allyship to say, hey, Chefs, we are doing this. We wonder if you can come speak to this group of people and all of that, despite the fact that we're an LGBTQI-led organization. Next slide, please. So we're also like designing and so we recommend that there should be design and implementation of culturally sensitive and pleasure-based comprehensive sexuality education curricula and programs tailored to address the needs and priorities of LGBTQ persons. Because all the information you see about comprehensive sexuality education or sexual reproductive health and rights is very punitive and very scary, and indulges in a lot of fear mongering. So we're seeing a lot of people who are scared to have sex for the wrong reasons, or organizations who are preaching total abstinence, gaining more tractions in communities and in digital spaces, right? So we host a lot of conversation to talk about sex and masculinity, sex, pleasure, and contraceptive. All of these conversations are also helping to open up conversation, to open up the minds of people to think about sex and other sexual activities beyond STI, beyond HIV, beyond death, beyond abortion and pregnancy, to more like fun and pleasure, and then it reduces the stigma of talking about sex. So international organizations should form partnership with regional and national LGBTQI groups and organizations to advance comprehensive sexuality advocacy in West Africa. Because if they don't get it from their classrooms, we need to bring it to them through community spaces, peer learning spaces, support groups, before they are able to get this from the wrong places. So we think that some level of direct grassroots mobilization in small circles, in communities, would make for a good reason or a good avenue to push out the accurate information on comprehensive sexuality education and advocacy as well. Next slide. So I think that's all. So great. So this is it, Anita.
Yes, just to add as part of the closure is that one of the things that we are major proponents of at Chevs is centering like the needs and priorities of queer persons within the major agendas across the world, across the globe. And with when it comes to CSC, that's the same thing that we're advocating for, that the needs and priorities of queer persons are centered also in the CSC agenda across, West Africa. We understand that it is challenging to work within the West African context, particularly as it relates to comprehensive sexuality education. However, we also recognize the power and the impact that international organizations play when it comes to improving access to CSE within other regions. Um, One thing that we hope for is that as more international organizations continue to advance CSE advocacy within the West African region, that they also really center what the needs of people are in terms of their sexual orientation, in terms of their gender identities and expressions, and ensuring that LGBTQI plus needs and priorities are not an afterthought. They are not just an addition, but something that is also central to the agenda as a whole. Thank you so much for having us, and we are available to take any questions or comments or clarifications.